Morning, ladies and gentlemen. Today we are going to interest ourselves in occupational health and safety, and it's a very important aspect of public health. And we are going to do an introduction to it, where the objectives of this session will be to define occupational health and safety, to explain its importance in public health, and to describe our roles in affecting that occupational health, and then the burden of occupational health injuries, and maybe look at the preventive measures that we can put in place to combat those occupational injuries. So occupational health is majorly preserving and protecting the human and facility resources in a workplace. So you think of any workplace, and you think of how you can protect the human resources or the workers there and the facilities that are in that workplace. So, whenever you do that, protecting and preserving the human and facility resources, then you're doing what we call occupational safety and health. So, you think of things like using those items that we have put in the slide, the gloves to protect your hands from getting in contact with toxic chemicals, the helmet to protect people from head injuries, those headphones to protect you from the noise pollution, and the respirator to protect you from inhaling anything that can be toxic and can be taken into the body through your nose. So this is all that is concerned with occupational health. As the name suggests, you're looking at the health at your occupation. So whenever you're preserving and protecting it, and protecting even the facilities or the equipment that is used in your workplace, then you are doing what we call occupational health. So the importance of studying this occupational health or effecting preservation of human resources in the workplace is that it will help to prevent catastrophic losses caused by explosions or fires. So when you put in place measures of occupational health, then you're able to prevent such fires. Yeah, this includes putting in place fire extinguishers, those fire blankets, all those that can be in a workplace to protect the facility and even the human resource from fires. So, of course, when you have fire, you always have catastrophic losses of either property or lives. So, whenever you put these occupational health measures, then you're able to prevent such losses. Then, second is improving the quality and efficiency at work. Yeah, with occupational health measures, then you're able to improve efficiency at work because there are minimized injuries. People are able to work uh, within a stipulated time using those rotational kind of measures whereby people are not so exhausted and are always uh, efficient at work. Then lifting injury exposures and allowing the organization to operate profitably. Yeah, all those are the importances of occupational health, and there could be even more because, especially this uh, fourth point of operating profitably by preventing the losses that could arise from not having occupational health measures, then the company will be able to operate in a profitable manner because the money that could be lost through maybe fires, through treating employees that have got injuries due to that poor occupational health, then you're able to prevent such losses and operate profitably. So we shall continue defining some key terms that we are going to be meeting in occupational health, and one of them is safety, which entails working in an acceptable or low probability of risk associated with the conditions or activities that have the potential to cause harm to the people, to the equipment, to the facilities of an enterprise. So when you work in such conditions which which have acceptable or low risk, then you're able to achieve that safety in a workplace. Then risk is that measure of the probability or and severity of a loss event taking place. Yeah, so the probability or the likelihood of a loss or a hazard in a workplace taking place is what we call a risk. And a hazard itself is the workplace condition or a worker action that can result in injury, illness, or other organizational loss. Yeah, so any action by a worker or any condition in the workplace that can result in an injury is what we call a hazard. Yeah, so it could be leaking of an acid solution that could also lead to that, or an action by a worker that causes maybe a short circuit that can result into a fire, or that will be categorized as a hazard. Then the other concepts that we need to define is loss prevention, loss control, and safety management. So loss prevention will be a program that is used to identify and correct potential accident problems before they occur or before they even result into that financial loss and injury. So the loss prevention is a proactive measure. It happens way before all these financial losses or injuries occur. So any program that is designed to prevent these injuries and losses occurring in a workplace is what we call the loss prevention program. Then in loss control, we look at minimizing the losses. So here, the loss could have occurred, but now we want to prevent or minimize the loss. So you look at things like use of those fire extinguishers, to prevent losses from being so great. Yeah. So loss control is put in place when the hazard has occurred, but in loss prevention, it is put in place before the hazard or the financial loss has occurred. And all the combination of the two, the prevention and control, is what we are calling safety management. And for it, it entails activities to do with planning, organizing, leading, and controlling activities necessary to achieve the organization's loss prevention and loss control goals. So, all those activities that prevent the financial losses and injuries from occurring and minimize the losses and injuries are what we call safety management. So, the losses that we can expect in occupational health and safety include deaths, where uh, people unfortunately end up dying, then injuries and illnesses. Yeah, so we shall look at some of these injuries and illnesses that can result from occupational uh, settings and how we can prevent them. Yeah. Then the study of occupational health, if furthered, or if you are going to 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 take it to a higher level, then you might end up having careers like an industrial hygienist who put in place measures to prevent those injuries in industrial settings. Then risk managers who are concerned with assessing those likelihoods of injuries and losses occurring, and then also assisting in putting in place those preventive measures. Then the safety professionals are also more like the industrial hygienists, and then safety engineers are the ones that put in place those modifications in the workplace to make it better and conducive for the worker. So the responsibilities of occupational health and safety professionals that we have looked at in the previous slide is that they are concerned with accident investigation. So whenever an accident or a hazard takes place, for example, a fire in an industry, then these occupational health and safety professionals are concerned with investigating what could be the cause, uh, what could have gone wrong to result into this fire, and then what measures were put in place to avert it, and then how were they effective. So all those are the responsibilities of these occupational health professionals. And public health professionals also end up doing such work. Yeah. So the other responsibility is to work with the emergency response teams whenever there is an accident which could cause an emergency. For example, again, I will use a fire, or maybe uh, leaking of a chemical that causes a lot of injuries to the workers in an industry. Then these occupational health and safety professionals have to work with those teams that have come to evacuate these people from danger. Yeah, they have to work with them because they will give them the history of that of that of that emergency that has taken place. What could have caused the fire? What measures were put in place at first? The medical history of those workers, because they are supposed to be the custodians of those medical forms, as we are going to see. Then environmental protection will be another responsibility of occupational health professionals. You cannot be an occupational health professional in a workplace and you allow it to pollute the environment. So environmental protection will be your responsibility in any workplace. Yeah, preventing any pollution of any kind will be your responsibility as an occupational health and safety professional. Then ergonomic uh, analysis and modification, which entails analyzing what the relationship between the workers and what they work with, the equipment, the machinery, and making sure that you organize the workers in such a way that they do not get harmed by what they are working with, and also organize what they are working with, the machinery and equipment, to make sure that they do not that machinery and equipment does not harm the workers. Then fire protection is a big responsibility of those occupational health safety professionals by putting in place those fire assembly points, making sure that the fire extinguishers are working, the workers themselves in any particular workplace which has those fire extinguishers know how to use them and when to use them, and the fire extinguishers are always serviced. Yeah, because I always see in some workplaces these fire extinguishers not being serviced, and yet they should be serviced on a regular basis so that they are always working. And workers in any workplace are supposed to be aware of how they work, so that whenever the, there is a fire outbreak, they do not have to wait for this professional to come and use it. Yeah. Then hazard recognition is that stepwise process of identifying a hazard and categorizing it and making sure that you put in place measures to prevent its occurrence. Then other responsibilities include hazardous material management. Whenever your workplace or a workplace is dealing in hazardous materials or producing byproducts that are hazardous, then occupational health and safety professionals are supposed to make sure that the materials are well managed, disposed of very well, and even handled with care. Then health hazard control will require the professionals to make sure that they put in place measures to prevent those hazards that can be of detrimental effect to the health of the workers. Yeah, the physical health of the workers should be their concern. Then inspection. Sometimes you might not be working in an industry, but you could be an occupational health professional at maybe in a government agency, which requires you to inspect how people in these industries are adhering to the set policies and regulations to protect the workers from these hazards and injuries. So once you do that, you're doing what we call inspection and auditing. Record keeping, like we said, these occupational health professionals are always the record keepers of, uh, of anything regarding occupational health. So they keep the medical records of workers. They have they should you should be they should be the custodians of past experiences of any hazard. If a fire took place, they should be able to record what could have caused it, what was done, so that it can inform future interventions of controlling fire. Then regulatory compliance is to make sure that the company or the industry they are working with complies with the set regulations by government agencies or international organizations. Training, like we highlighted earlier, is the fact that they have to engage workers in in training of how to use some of these equipment that control fire, on how to correctly use personal protective equipment to shield them from these occupational health hazards. So all these are responsibilities of occupational health and safety professionals. So you can always recognize that they are very essential professionals in the workplaces, especially those that are prone to causing health hazards. So they investigate accidents, they work with emergency response teams, they they make sure that the environment is protected, they modify and analyze the relationship between workers and what they are working with, and then they deal in fire protection, hazard recognition, hazardous material management, health hazard control. They inspect workplaces, make sure that they are complying with the set regulations of occupational health. They record everything that takes place in the workplace as regard to health hazards, and then they do regulatory compliance and deal in training of workers to make sure that they are knowledgeable on how to prevent some of these health hazards. So the safety regulations that are in place to make sure that occupational health and safety is achieved include the government laws that promote those occupational health and safety, And in South Sudan, we have the South Sudan Labor Act of 2017, which is also guided by the International Labour Organization that was put in place and in the US to make sure that it guides other countries on how to mitigate some of these health hazards in the workplace, and also advocate for the rights of workers in any workplace. So the roles of employers in occupational health is: number one, to examine the workplace condition. They're supposed to be aware of the workplace conditions in which their employees work, and then to minimize and reduce the hazards in that workplace, to use and oversee use of these color codes. Yeah, those color codes will always enable people to dispose of hazardous materials in a correct way, and then prevent those hazardous materials from getting in contact with people, and the injuries that could result from them. Then they make sure that posters are in place. Yeah, those posters that indicate that maybe something is highly flammable, that maybe this place shouldn't be accessed without a mask because there is an irritant gas or a hazardous gas. Those signs that are put in place to warn employees of potential hazards is what we are talking about. So all those are the roles of employers, and they also go on to provide training and or facilitate that training by occupational health and safety professionals, and then they keep those OSHA required records, or the occupational safety and health administration records. Yeah, those of course include the medical records of workers, the records of the past experiences of hazards and how they were able to prevent them. And then the other role is to provide access to employee medical records, especially to the people who come to inspect. Yeah, because inspectors from maybe government agencies will come to your workplace and will need these records to make sure that the workers who are in your workplace are not sick, and if they are, they have been provided with the required medical treatment. Yeah, so all those are the roles of employers. So the categories of occupational injuries can be partial, whereby there isn't total damage of an organ or a part of the body. Then total, it can include uh, that extreme damage of a body or a body part. And then temporary will be treated, an injury that can be treated and you heal from it. But permanent will be an injury that you will have to bear for the rest of your life. So these could include those disabilities that are as a result of injuries from your workplace. So if someone gets an amputation or if they lose their leg, then that is a permanent injury. And we should be able to appreciate the relevance of these injuries, because they are they are the knowledge of such will enable us to put in place measures to prevent such injuries, and also inform policy. Because if someone gets a permanent injury, there should be compensatory measures that are in place to enable them live their life in somehow a normal way. Yeah, either by compensating the family of such a person, or making sure that such a person gets something to enable them go on with their normal life, either uh, another another work or another work category that pays them in the same way, or getting maybe a prosthetic leg if they have lost one, or using a wheelchair. So all those should be put in place to make sure that the people that have suffered from these injuries do not end up losing their livelihoods. So the public health skills that are required in a workplace illness prevention are those that play a vital role in promoting and ensuring workplace health and safety. So, as a public health professional, you might be required to work in in an environment which which is which produces these hazardous materials, like an industry, as an occupational health and safety professional. So you require some of these skills that we are going to talk about, and they will help you to promote and ensure workplace health and safety. So when you utilize these skills, then you are able to prevent and reduce the occurrence of workplace illnesses and injuries. So these skills will be very essential in proactively putting in place measures that can prevent some of these illnesses and injuries from occurring. And skill number one is epidemiology. You should be able to have that skill. You cannot be a public health professional when you do not have epidemiology at your fingertips. So you should be able to analyze the trends and patterns of workplace injuries and illnesses. Should be able to know how, when, and to whom do these injuries occur. Okay, so you identify the risk factors that could lead to some of these injuries, and develop those targeted prevention strategies. So if you realize that some people working in a particular uh, component of an industry are suffering from occupational asthma, or they are having breathing problems, then you can very well put in place measures to prevent such people from getting to inhale hazardous material that is related to that particular component of the environment. Yeah, or you can put in place measures that that improve the ventilation of such environment, so that whenever the hazardous material is produced, it can be effectively taken out from that environment. Yeah, so those that is the skill of epidemiology that will help you to analyze the trends and the patterns, the risk factors of developing some of these illnesses and injuries related to to a workplace, and then putting in place those targeted strategies. Then risk assessment will require you to assess and evaluate workplace hazards and their potential impact on the worker's health. So here you analyze the likelihood of these hazards occurring. Okay, so if you see that a particular hazard is likely to occur more than another, then you make sure that hazard is given more priority. So this is why we are saying that it informs the development of preventive measures and control strategies. Yeah, so you should not sit and wait for a hazard to occur, but you should assess and evaluate those hazards that can be in a workplace, and then put in place prevention and control strategies. Then the other skill is health promotion and education, and like we said earlier on, as a public as an occupational health and safety professional, you should be able to raise awareness about workplace hazards and promote healthy behaviors among the workers. So the workers should be able to know which hazards exist in their workplace. Okay, which components of their workplace can be detrimental to their health if not handled very well. Okay, yeah, it could be a fire, it could be an acid leakage, it could be a very poisonous gas to which, if exposed, they will be able to get those injuries or illnesses. So they should be able to know these things because some workers might not be having that prior knowledge. So it is that public health skill that an occupational health and safety professional is supposed to possess to educate these people on the proper use of PPE to prevent some of those some contact, inhalation, and ingestion of those hazardous materials. And then they should be able to know the overall safe work practices. Yeah, change behavior. If you have not been using PPE, you should be able to advocate for change of that behavior so that those workers can be able to correctly use PPE to prevent some of those illnesses. Then policy development requires them or requires any occupational health and safety professional to collaborate with stakeholders to develop and implement workplace health and safety policies. So these policies are the ones that guide uh, these regulations that are put in place in a workplace to prevent and control these hazards from occurring. So it is also their role or the role of occupational health and safety professionals to advocate for regulations and standards that protect worker health. Yeah, so all these are the skills that are required by their public health skills that come in handy to prevent workplace illnesses. So let's look at the roles of public health departments. What are they concerned with, these departments of public health? Why are they important in occupational health? So these departments of public health are important to do one, surveillance and data collection, which will require them to collect and analyze data on workplace illnesses, injuries, and hazards. So public health departments in this case will be able to use that data that they have collected from people who have suffered from illnesses due to the workplace, the injuries, and the hazards in place. So they will use that data to monitor trends and identify areas of concern so as to put in place targeted interventions. Yeah, so surveillance is more of that continuous collection of data and analyzing it and reporting it to the relevant stakeholders to put in place those measures to prevent those health hazards. Yeah, then the other role of public health departments, these could be these public health departments could be at district level, they could be at a county level or a local level, they could also be at a national level. So these are the roles that we are talking about that they are supposed to perform. So the second role is health inspection and compliance. So they are able to conduct workplace inspections or to inspect workplaces so that they can ensure that these workplaces are complying with the health and safety regulations. Are there fire extinguishers in this workplace? You know, are the workers using personal protective equipment? Are they having medical records? To show that they undergo routine checkups and whenever they get sick, they are treated. All those are supposed to be included in the medical forms, and then providing guidance and support to employers to improve workplace conditions. So whenever you do your inspection, at the end of that inspection, you are supposed to provide guidance and support to these employers, because some of these employers are not aware of what they are supposed to do or how they are supposed to do it. So whenever you find there is a gap, you provide that guidance and support as a public health department or as a person working in a public health department. Then the other role of these public health departments is health promotion and education, where they conduct outreach campaigns to raise awareness about workplace health and safety. So this public health department in a local setting can go to that local industry and provide this outreach campaign to make sure that the workers are able to recognize these health hazards that are in their workplace, and then how they can deal with them. So they offer these training programs and resources to enhance worker knowledge and skills. Yeah, they can even provide those banners that show how to 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 correctly use these personal protective equipment. They can provide those banners to show those the labels of hazardous materials. All those can be roles of public health departments. Then they also go on to develop and implement policies and regulations to protect workers' health by collaborating with the relevant stakeholders, which who will include the employers, the representatives of employees, the policy makers, so as to advocate for evidence-based workplace health initiatives. Yeah, and very key to note is that evidence-based. For you to convince these stakeholders, you must be having evidence, which we said you can collect through surveillance and data collection. So you cannot go to discuss with, for example, the employers, and you tell them that your workplace is having is likely to cause cancer to the workers without this evidence. You're supposed to have this evidence which will convince these stakeholders to put in place these workplace health initiatives and policies to protect the workers and from these injuries and illnesses. So advantages of partnerships between public health departments and the workplace will include expertise and resources, whereby the public health departments bring that specialized knowledge and resources to assist workplaces and in addressing health and safety challenges. Like I said, some of these employers or these workplace managers might not know about these the might not know about these health hazards and how to prevent them. So a partnership between the public health department and this workplace will enable that specialized knowledge and resources to come in, so that they can be guided on how to recognize and prevent or control these health hazards. Then the other advantage of collaboration between the workplace and public health departments is collaborative problem solving. So here, when you partner, you're able to join efforts to foster innovative solutions and shared responsibility, so as to have a better workplace. Then these workplaces benefit from public health guidance in designing effective prevention strategies. Yeah, so all this is entailed in collaborative problem solving. You are able to to contribute knowledge, you know, able to share knowledge between the workplace managers or their employers and their public health departments are able to share knowledge on how to effectively prevent these workplace illnesses, on how to innovate solutions to some of the new hazards which might not be uh, very common, so that in the end you have a better workplace health. Then the other advantage is enhanced compliance. When these two partner, then because these public health departments provide that expertise, then the employers are able to understand and meet those health and safety regulations. And in so doing, they comply with the set regulations. And this is all done through correct health education, support, and guidance. So the public health department should not be very hard on these workplaces or the employers, but they should be able to educate them so that they can truly understand and appreciate the effect of these workplace hazards. Okay, and through that, they are able to put in place those control measures and to comply with the set guidelines and regulations. So before you enforce your penalties as a public health department, you're supposed to educate, you're supposed to support and guide them on how things are done. Then data sharing and surveillance. The workplaces always contribute valuable data to these public health departments so as to do that surveillance and monitor these workplace illnesses so as to put in place those targeted prevention measures. So those are the advantages of partnering between the partnerships between workplaces and public health departments. They are able to share expertise and resources. They are able to do collaborative problem solving, enhanced compliance, and then data sharing and surveillance. Now let's look at epidemiology of occupational safety and health. So epidemiology plays a very crucial role in understanding the occurrence, the distribution, and determinants of occupational injuries and illnesses. So in this session, we are going to provide an overview of epidemiology of occupational safety and health and its significance in public health. So you can think that occupational epidemiology, by definition, uh, is that focuses on studying the relationship between work-related or exposures and adverse health outcomes. So by definition, occupational epidemiology investigates the distribution, the determinants, and sometimes the patterns and the trends, and also analyzes prevention of occupational injuries, diseases, and disabilities. So in occupational epidemiology or in any epidemiology, you're able to look at the distribution, the patterns, the trends, the determinants of any illness or any injury. And in this case, we are looking at occupational injuries, diseases, and disabilities. So you ask those questions of how do these injuries occur, to who, which people are most affected by these injuries, and what could be the cause of these injuries. Okay, so that you can put in place those targeted interventions. Your interventions should be able to prevent, should be specific in nature so that they prevent or control those injuries that are in place. Your intervention should not be this of trial and error, whereby you do not know, you're not sure of what to prevent. So that is why occupational epidemiology is very important. And the key concepts in occupational epidemiology include occupational hazards, which are the physical, the chemical, the biological, and psychosocial factors that can cause harm to workers. Then exposure assessment, which includes quantifying and characterizing the level and duration of exposure to occupational hazards. And then the health outcomes will be those work-related injuries, illnesses, and disabilities experienced by workers after exposure to those health hazards. And then the risk factors will be those work-related factors and individual characteristics that increase the likelihood of an adverse health outcome. Yeah, so it could be either a work-related factor, for example, working for a long time in that environment which is hazardous, or it could be individual characteristics, maybe someone's past health history. If someone is already suffering from asthma and then they are exposed to a workplace which is producing poisonous gases, then of course they will be at a more or at a higher risk to develop health complications than the person who is not having that history of asthma. So all these are the key concepts in occupational epidemiology. And then the methods that are used in occupational epidemiology include surveillance, which, like we said earlier, includes continuous collecting and analyzing of data related to workplace injuries, illnesses, and deaths to identify those trends and patterns. Then, cohort studies uh, will include following a group of workers over time to assess the association between exposure, occupational exposures, and health outcomes. So here, you follow a group of workers who have not developed a health outcome, and then you follow them for a given time to see if they develop such a health outcome. So you can think of an industry that produces a poisonous gas, which is having a heavy material like lead, which is known to be carcinogenic or to lead to cancer. So you follow them for maybe 5 years, and you choose a group of workers who are maybe working in such a work in that component of an industry which produces that poisonous gas having lead. You follow them for 5 years, and you see if they are able to develop this uh, this cancer due to lead, which could be lung cancer or any other cancer that can result from lead poisoning. So follow them for that particular time, like 5 years, and then you see if they are able to develop that cancer or not. Then in case control studies, here you start with the health outcome, and then you analyze going backwards to see if that health outcome is related to particular risk factors. So you have the the workers who are in the case group and then the control group. So in the case group, you have maybe people who have already developed the lung cancer in that workplace, and then in the control group, you have those who haven't developed the lung cancer. Then now you analyze backwards to to see what could have led to that lung cancer, which will be able to enable you identify these risk factors. So here you compare workers with specific health outcomes. And in this place, we have used an example of lung cancer to those without that outcome, who we've called the controls, or those who don't have the lung cancer. And then once you analyze going backwards, you're able to see or identify those risk factors that could have led to lung cancer. Maybe you will discover that maybe these people who are having lung cancer were working in the component of that industry that was producing a poisonous gas, and it was having lead, you know. So that is able to tell you that the risk factor for that lung cancer was lead poisoning. Then the other methods, apart from surveillance, cohort studies, and case control studies, can include cross-sectional studies where you take a snapshot. So this is this does not require you to follow these people over time, like in cohort and case control. Here, you just look at many variables at a go. So you can look at age, you can look at sex, you can look at education level in relation to a particular exposure, maybe to lead poisoning, or a particular outcome, health outcome like lung cancer. So all these variables are able to be studied at once using this snapshot study that we are calling cross-sectional study. Yeah, so it assesses the prevalence of exposures and health outcomes of a specific at a specific point in time. You do not have to follow these workers over a long period of time. Then intervention studies evaluate the effectiveness of interventions or preventive measures in reducing occupational hazards and improving worker health. So if you have put in place uh, if you have put in place an intervention of if you realize that in a particular component of your industry in which you are working as an occupational safety officer or professional, that there is increased allergic reactions among workers in that component, and then you put in place an intervention of putting on these masks. So, and in an intervention study, you want to evaluate whether putting on of these masks has been effective in averting these allergic reactions. So you evaluate the effectiveness and then identify gaps maybe that need to be filled, and then you put in place those measures to fill those gaps. So that is what we call intervention studies. So the methods that can be used in occupational epidemiology, or that can be used to identify the patterns, the distributions, the determinants of these of occupational health, will include surveillance, cohort studies, case control studies, that cross-sectional study, and then intervention studies. So the value or the importance of workplace surveillance systems is that it enables early detection of occupational hazards, because you have your data. If there is an increase in cases of allergic reactions among among workers in a particular component of an industry, then you're able to detect this occupational hazard and put in place uh, prevention measures which are timely. Then they also provide insights into high risk occupations, industries, and specific hazards, allowing targeted interventions. Yeah, so this data that is collected through this surveillance system is able to inform you about those high risk occupations, the industries, and specific hazards. There could be a component of the industry that has workers who are not having any complaints at all, maybe those dealing in records. Okay. So if they are if that one is if you have if you are collecting this surveillance data, you're able to know that This occupation is low risk and then the other is high risk, and then you put in place those targeted interventions. If it is a high risk, then you have to take more precaution, and you have to also educate the workers who are in such an occupation. Then by monitoring disease trends and surveillance, by monitoring these disease trends, the surveillance systems help to evaluate the effectiveness of preventive measures and interventions. So if you put in place an intervention, like we said, to prevent uh, allergies, and then you see your disease or those allergies are increasing, then you know that that intervention is not working. Okay, so you put in place another. But if you see that the disease trend or that those allergies are reducing, then you know it is working, and then you're able to enforce it. So in occupational health, we also find that we have the chain of infection. Yeah, it is the one that we also see in infectious diseases, but even in occupational health, uh, the knowledge of this chain of infection will help us to prevent and control diseases, injuries, and illnesses that could result from uh, from these workplaces. So the chain of this infection explains how diseases are spread and the necessary conditions that should be in place to transmit for transmission in these occupational settings. So it consists of of uh, of things like the infectious agent, the reservoir, the port of exit, the mode of transmission, the port of entry, and the susceptible host. So from the infectious agent, you have your disease going to the reservoir, and then from the reservoir, it goes through that port of exit on the reservoir to and goes through that mode of transmission to the port of entry on the susceptible host, and this susceptible host is able to develop this disease. So if you understand this chain of infection, you're able to identify those points of interventions and control measures. So you can think of a disease like malaria, whereby the infectious agent is Plasmodium falciparum. So this Plasmodium will be in a mosquito as a reservoir, and then the point of exit will be that 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 proboscis or that mouth part, and then the mode of transmission will be that mosquito bite, and then the point of entry in the susceptible host uh, will be that your skin, in which this mosquito is going to inject this will be will this skin that the mosquito will be able to bite and infect you with this malaria parasite. Then the susceptible host is the person that gains this malaria. So this chain can also be used in workplaces. It might not be having all these parts, but you, as a public health professional, you're supposed to identify uh, those parts in a workplace, that all those points that need to be targeted for intervention. For example, if you are in a workplace that if you are in a workplace that is related to lead poisoning, so you should be able to shield yourself from that lead poisoning from getting in contact with you who is working in that workplace. So by shielding yourself from contact with this equipment that could be having this lead poison, or that could be that could be contaminated with this lead poison, then you're able to cut that chain of infection or transmission of this lead poisoning from that contaminated part to you. So this is why this chain of infection is very important. So these occupational health interventions focus on interrupting the chain at different levels to prevent disease transmission. And by breaking this chain, public health measures can effectively reduce the workplace related illnesses and infections. So, like we said, public health interventions are put in place to break these different stages or the transmission cycle involved in this chain of infection. So, like in malaria, you want to prevent the bite of a mosquito from reaching the skin of the susceptible host. But uh, you can also prevent the the this malaria from reaching the skin. Okay, by putting in place interventions like bed nets, those mosquito nets that shield the skin or the susceptible host from those malaria, from those mosquito bites, you know. But you can also kill the mosquitoes before they reach even your house. You can clear those bushes or the stagnant water around your homestead to prevent the malaria from to prevent the mosquitoes from even gaining access to the to the house where they could bite an individual. But you can also put in place measures whereby an individual who is sick does not transmit this parasite to the mosquito, which will carry it to another susceptible host by treating this individual. When you treat, then this parasite will not be transmitted by the mosquito, even if they are bitten by it. Then we have rates which are used in occupational health, and these rates are essential in measuring the occurrence and impact of health problems in a workplace. And the most common ones are incidence rates and prevalence rates. And in incidence rates, we look at the new cases of a particular illness or injury or disease in a specified period, while in prevalence, we look at the total number of cases at a specific time, which reflects the burden of the condition in the population. While in incidence, we are looking at the risk of developing a condition. So if we are, for example, looking at occupational asthma or difficulty in breathing due to inhalation of a hazardous component of in a workplace, then if we are analyzing that occupational asthma in maybe the month of June, then in incidence rates, we are going to look at the new cases of that occupational health in that month of June. But prevalence, we are going to look at we are going to look at the new cases plus the old cases of this occupational health. So even those cases of uh, of this occupational asthma from May, from April, from January, from Feb and March will be factored in when we are talking about prevalence rates, but the incidence rate will be only those new cases of that particular month of June. So the use of these rates is that we are able to identify priority areas for intervention and assess the effectiveness of preventive measures. Like I said, if you see that your prevention measure, which you put in place to prevent some of these illnesses, is not working by 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 noting that the disease cases or these rates are increasing, then you're able to know that you should put in place another intervention so as to prevent that particular illness. So again, they enable the comparison across workplaces, industries, and populations, identify disparities and target resources. Then the other use of rates is that public health professionals utilize them to define and quantify the magnitude of workplace health problems. So if there is a particular health hazard that has more incidence rates or has a bigger prevalence than the other, then you are able to know that it is of bigger magnitude than the others, which have less cases or less rate or less prevalence and incidence. So these cases, the new cases and the old cases, are able to show you and enable you to quantify the magnitude of workplace health problems. So in epidemiology, we also have to understand what we call case definition. And in case definition, we identify and classify specific health problems in a workplace. And this provides a consistent criteria for identifying and reporting cases of occupational illnesses and injuries. For example, if you're talking about lead poisoning, you should be able to define the case of lead poisoning very well. So if it is characterized by maybe shortness of breath, irritability, constant headaches, so that is what we call case definition, whereby you're able to identify and classify those specific health problems. Lead poisoning should be differentiated from arsenic poisoning or poisoning that is due to a heavy material called arsenic. So, if lead is characterized by constant headaches, irritability, and maybe confusion, then arsenic should also be classified in its own way so that you can be able to differentiate these two. And when you're able to differentiate these two, it will help you to standardize these surveillance systems. You know, yeah. Cases of arsenic poisoning should not be confused with those of lead poisoning, so that when you put in place an intervention, it is targeted, you know, because you have accurate and comparable data. So all this facilitates epidemiological investigations and supports development of preventive strategies. Because if you confuse the two, you confuse arsenic and lead, then you could have uh, a number that is not right. You could think that people who are having arsenic poisoning are the same as those who are having lead poisoning because you haven't defined your case very well. So here you might find your preventive strategies not targeted. You might have, you might think that you have more cases of lead poisoning when in actual sense there is another poisoning that is supposed to be targeted. So you put in place only prevention measures for lead poisoning, yet there is another poisoning, which is in this case, in that example that I've given, arsenic. So that is why case definition is very important. So the common occupational health conditions that we are likely to face in our practice include occupational injuries like falls, cuts, strains, respiratory diseases like occupational asthma, pneumoconiosis, then musculoskeletal disorders like back pain, disease and noise-induced hearing loss, dermatological conditions like the inflammation of the skin, and then occupational cancers due to some of these heavy metals like lead, asbestos, and arsenic. So we also realize that in occupational health there are always those disparities And in this case, certain populations experience disproportionate occupational health risks and disparities. And examples include those vulnerable workers, minority populations, low income workers, and immigrant workers. So these people, because due to the nature of their social socio-economic background, they are always exposed to some of these occupational health hazards in a disproportionate manner. So this is where occupational epidemiology comes in to help identify and address these disparities to promote equitable and safe working conditions. It should not be that only migrant workers or minority groups like the refugees or those who are vulnerable are the ones to work in a particular workplace which is more hazardous than the other. Yeah, this is in most cases the case, but occupational epidemiology is able to come in handy to identify some of those disparities so as to promote equity and these safe working conditions for these people who are disproportionately affected by these occupational health hazards. So the prevention and control strategies that can be put in place to prevent some of these occupational health hazards include risk assessment, where you look at the likelihood of these hazards occurring, and then you're able to put in place measures to prevent them. And then engineering controls, where you modify the work environment to eliminate or minimize hazards. And an example here can be improved ventilation in an industry that is producing poisonous gases. And then administrative controls, which are policies and procedures to reduce exposure to the hazards. An example could be using shifts whereby workers will be less exposed to some of these hazards. Yeah, you do not have to make a worker be exposed to a certain hazardous environment for long, but you can implement strategies like shifts where they work for less hours so that the exposure can be reduced. But you can also put in place use of PPE or providing appropriate personal protective equipment to shield these workers from exposure risks. Then health promotion and education. Here you raise awareness and promote those healthy behaviors which will prevent exposure to these health hazards in a workplace. Then regulatory frameworks and standards should be implemented to protect the worker safety and health and their health. So, of course, these include labeling clearly those hazardous environments, making sure that the, the the workers are provided with this PPE, because in some workplaces, by the way, these workers do not are not even provided with the PPE. The workers might want to use it, but the employers are not providing them. They are not doing these regular checkups, these medical checkups. So by implementing and enforcing those regulations, you're able to protect workers' health and their safety. So this brings us to the end of this session where we looked at occupational health, and it was more of an overview, and we defined occupational health. We looked at the roles of occupational health and safety professionals, and then we looked at advantages of partnerships between the public health departments and workplaces. We looked at occupational epidemiology and at some of those common occupational health conditions and how to prevent them. So we shall be looking at occupational health in depth in our subsequent sessions. But for today, let's end at this. Thank you so much for your time.